Hello and welcome to our special show Fighting COVID with Randeep Guleria, where Dr. Guleria takes all our questions on developments in the past week, on COVID, on variants and vaccines. Thank you so much, Dr. Guleria, for joining us on the program. And let's just, get right to it. One of the questions that many people are asking ever since the AIIMS said that we are about a third wave and how we're seeing the beginnings of a third wave in some states. So if you could answer that question, are we seeing the beginnings of a third wave?
So it's a difficult question because I think the second wave is not finished and we are seeing still around 40,000 cases a day. And in certain states, for example, Kerala and also in Maharashtra, cases are still there. So we are still seeing the second wave in its sort of the tail of the second wave, if I put it that way, although the number is significant. But yes, it is also possible that if we don't control this part, because this is plateaued now for quite some time, then this can lead to resurgence and spread of cases to other areas and may be the beginning of a third wave. So I think the message that I would like to really put forward is that we need to aggressively try and bring our numbers down in these areas where the cases still continue to be high for two reasons. One is that they should not spread to the other areas. And secondly, we know that if you have cases in an area and the virus continues to multiply, then the chance of developing a new variant becomes higher, and that can lead to more problems in subsequent months.
All right, that brings me to my next question, which is connected to the first, is why are the cases so high in Kerala? Because, there's been so much said about the Kerala model. Then there was the Sero survey that was done, which showed that just around 40% of Kerala was affected by COVID, whereas, in other states like in UP and Madhya Pradesh, it was much higher. Madhya Pradesh was the highest, around 80%. So the reasoning that I've spoken to many experts in Kerala, the reasoning they're giving is that we were very good at enforcing the lockdown, so much of our population has not been affected, but with the restrictions easing, now the virus is spreading among the people.
So I think there can be multiple factors. I'm not sure that we have the correct answer right now.
Sure.
One factor, like you rightly said, is that susceptible population is higher in that state as compared to others because of the better control that they were able to have in the early part of the pandemic. Secondly, also, as restrictions have come down, and we saw that during the festive season also, there was a lot of mixing that happened when people were not taking COVID appropriate behavior seriously. Now, if you do that and you have a large susceptible population, it will lead to the spread of the virus quickly in that area. We also know that the Delta variant is much more infectious, is spread more rapidly, and that new variant also, when it comes into a susceptible population, which will lead to a surge in the number of cases. Also, I think because of a little bit of laxity, the initial policy that we have of aggressive containment, of testing, tracking, and isolating people was not done that aggressively. A lot of people were on home isolation, but were not following home isolation norms. They were going out, mixing with others, and that led to the spread of the infection to areas where it should not have spread. So I think that is why we need to take aggressive action. But I think I am hopeful that over the next few weeks, the cases there should now start coming down.
Right. And the center has said that it feels that there's a need for, a smart lockdown and perhaps lockdown in some places, but it doesn't seem that's something the Kerala government is keen to do.
Yes. So I think there is a little bit, I would actually favor having a lockdown because, like I said, if we continue to have cases which are rising, it may lead to new variants emerging, and that is a cause of concern. Yes, there is one thing that is there, that as of now, this is not translated to a huge surge in the number of admissions in terms of hospitalization or deaths. So it is actually predominantly a mild to moderate illness that we're seeing, which is a good sign, which suggests that the virus is not that virulent. But still, we need to really bring our cases down as we move forward. And the concern, of course, is that with the festive season occurring in other parts of the country, yes, we don't want the virus to spread from that state to other states where, again, there will be a lot of crowds developing during the festive season.
In fact, the center said the impact is being felt on neighboring states. Now, you spoke about variants, and that brings me to our next question is, what is this new MU variant that WHO has called a variant of interest?
So this variant has been seen in parts of Colombia and South America. And there is a concern that this variant may be more infectious, but it's still a variant of interest. More data is needed before we can really say that this is a variant of concern. as we've been saying for the last many months, that this virus will continue to mutate and new variants will develop. We have another variant, the C1.2, which has also been reported. And therefore, these variants will continue to develop. Some of them will be just variants of interest. But as data emerges, we will get a better idea whether they are causing more serious disease, whether it's becoming more infectious, or are developing an immune escape mechanism so that our vaccines are not working. So currently, it is still a variant of interest, but we need to really monitor it more closely as we're doing with other variants, including the Delta Plus variant.
All right, and that brings me to a question on the C.1.2 variant, and which has emerged from South Africa. How worried should we be about it? Because it has spread to other countries, and there is some talk of how it's escaping vaccines. It can escape immunity.
Yes, so there is some data emerging from Africa that this variant may be more infectious and may have have developed some degree of immune escape mechanism. So this is something we need to watch more closely, both in terms of whether this variant has come to our country, and we need to really screen people who are coming from areas where this variant has been reported, and at the same time observe whether this is causing more serious disease or is spreading more rapidly. So I think this is something we need to monitor, watch very closely, both in terms of its infectiousness and in terms of how it is affecting the vaccine efficacy.
All right. Recently, the UK vaccine advisors have decided against vaccine for children between the ages of 12 to 15 years. They've said, however, for children who are more vulnerable, that, do go ahead and give them the vaccine. Why is this? Explain this to us, because this has, of course, raised concerns among parents at a time when we're waiting for vaccines for children.
So what data that we have currently, and I think it's let's look at it from the point of view that we have limited vaccine. Who should we vaccinate first? We should obviously vaccinate those who have a higher chance of dying because of COVID-19. And that means the elderly, those with comorbidities, and children who have low immunity who have comorbidities. But we also know that healthy children have usually mild disease, and majority of them, the mortality in children is very, very low as compared to, let's say, the older age group, the elderly. Therefore, one should focus, if you have limited vaccine, the priority group should be those in whom you need to really give vaccine to protect their lives, and that is the elderly population, those with comorbidities. So I think the focus has been that let us first vaccinate them. We should not have a situation that children get vaccinated and the elderly get left behind because of the vaccine being given to children. So I think that is what is being done, that they're wanting that first the elderly population, the high risk population, and children who have comorbidities and thereby may have severe COVID are vaccinated, because healthy children still have very mild disease, and that is what the data suggests. So I think that is what we need to look at. Even in our country, still a large number of the elderly have not been vaccinated, and even those with comorbidities still are not coming forward and getting vaccinated. So I think we need to push for them to come forward and get vaccinated, because they can actually account for higher mortality.
All right, that was my next question, that when are we going to get vaccines for those under 18 years of age in India? And so we're also going to be looking at it in this way, that children who have some sort of, health issues, that they're the ones who are going to get it first. And the point that you raised, that, we still haven't vaccinated enough of our adults percentage wise. And if we're going to start vaccinating children, it will take away from the adults.
So that's the point I was making. But I think we must also be confident that in the coming months we will have enough doses available, so that we should be able to try and develop a strategy of vaccinating both the children between the age of 12 to 18 years and the elderly and the high risk group. So I think our capacity should go up, and as we are seeing more and more vaccines are coming into the market, Zydus COVID has also been given emergency use authorization. Sputnik is already there. We have both.
When will the Zydus COVID be available? Because that news was there for some time that it's got the emergency use authorization.
So I think now that it's got emergency use authorization, the company has to start looking at how they can market it. And hopefully within the next few weeks or in a month or so, they should have it in the market. The strategy would be who to give it to, how to prioritize it. It could be that since this vaccine is approved for children also, one could see that can we give this to children and the other vaccines could continue to vaccinate. We could continue to vaccinate the elderly and the high risk group. So that strategy can be developed. But I think we need to really vaccinate our high risk also, and we need to really address the issue of vaccine hesitancy.
Right, absolutely. But, now with schools reopening and that push is taking place in many states, a lot of the parents are getting very anxious, and they say we want to vaccinate the children before we send them to schools.
Yes, but I think I will agree that, it will give more confidence to parents if the children are vaccinated and then going to school would be, they would feel safer. But like I said, two things are very important. One is that we know that vaccines will prevent from serious disease. Children don't get that serious disease, but they do not prevent from infection. So even if you vaccinate children, they may still get a mild infection, which would be like fever, cough and cold, but they would be infectious. And they could bring the infection home and give it to the elderly there and cause them to get serious disease. So vaccinating the elderly becomes more important in that family rather than the children, because if the elderly are not vaccinated and the child is vaccinated, the child will get a mild illness and become all right, but the elderly who has not been vaccinated may get a serious illness. So that is why I again would like to stress that we should focus on the high risk group first, but children should also get vaccinated at some point in time. Also, vaccination, the efficacy of the vaccination will decrease with time. So we will have to look at strategies of, subsequent boosters which are required. And there again, it will be more for those whose immunity is low rather than those whose immunity is good enough.
All right, because recently there was also this report that talked about, a study that talked about how that children also get long COVID. So while majority of children get mild infection or mild illness, there are also reports of long COVID in children, and I think the numbers were 1 in 7 or something like that. So that again, doctor, it's going to raise the anxiety of parents.
Yes, that's true. Children also do get long COVID. We also have multi-system inflammatory syndrome of children, which we do see in children, but also at times in adults also. So there are long-term complications that we do see from COVID, which is something that we're learning about more and more now as we are sort of seeing less of COVID and more of long COVID. So I do agree that those are other issues that we need to address, and we need to really see how do we manage long COVID in adults and in children, and develop strategies both in terms of specialized clinics and a multidisciplinary approach as far as this is concerned.
All right, and there was also a report that said that double vaccination halves the risk of long COVID, because we do know there, even if you are doubly vaccinated, you can still get the infection. They're breakthrough infections, that's what they're called. But good news that it will halve the risk of suffering from long COVID, which we're seeing more and more of.
Yes, so there are studies which suggest that if you have taken the vaccination, then the chance of developing long COVID, even if you get COVID, is much less. It comes down by 50%. And that also makes sense, because once you get the vaccine, you don't get severe disease, you don't get hospitalized. And we know that long COVID is relatively more in those people who are hospitalized, who have moderate to severe disease, and thereby develop long COVID. So if you get vaccinated, you get a mild disease, chance of developing post-COVID sequelae or long COVID becomes less.
And all the more reason to get vaccinated and do away with that vaccine hesitancy. We'll slip into a short break, Dr. Guleria, and we'll be back with more questions for you. Welcome back to our special show, Fighting COVID with Dr. Guleria. And Dr. Guleria, my next question actually is not to do with COVID. It's to do with this fever that we're seeing in Western UP, in which, a large number of children are dying. We're told that it's dengue, and, coming in a time of pandemic, and when we've already seen those visuals of children and patients in hospitals, it does raise concerns. According to the central team, it is a form of very severe dengue.
So we need to have more data. It seems to be a viral fever which is causing infection and decrease in counts. But the etiology needs to be clear, because dengue, by and large, if managed properly, has a low mortality. Dengue can lead to low platelets. It can lead to hemoconcentration. But by and large, it has a low mortality. So a large number of deaths that are being reported needs to be looked at more closely. Because there can be other infections, including infections like scrub typhus, which can also cause similar type of illness. So it looks like a viral illness, but I think we need more data and epidemiological study to see what it is. If it is dengue, then a lot of vector-borne disease control is required, and very close monitoring and management with fluids would be required.
Right, absolutely. In fact, a lot of the samples collected, they say out of 200, 100 were found to have dengue, and typhus as well was reported in some of the cases and some of the samples.
Correct. So that's what I'm saying. We need to look at it, because dengue alone usually causes severe illness, and can lead to bleeding from different sides. It can lead to what we call hemoconcentration and shock, dengue shock syndrome. But it's not that such high mortality usually occurs because of dengue.
All right. Well, we'll wait for more, information. A report is expected on Monday. Coming back to coronavirus and the vaccine drive, right now, India is hoping to vaccinate 60% of the adult population by December. But at the rate we're going, we actually have to be vaccinating over 1 crore every day if we're going to reach that number. But what about immunity erosion, doctor? Because that has become a big concern now. Those who may have received, the vaccine doses at the start of the year, their immunity would be waning now. What do we know about this?
So this is a difficult question, because we don't have enough data. There is really no sort of data to suggest that this level of antibodies or this level of cell-mediated immunity means that your immunity is now low and you will get severe disease. So to say when should we take a booster dose is very difficult. Should it be taken now? Should it be taken after 9 months or 1 year? And also, what type of booster should we take? Should it be the same vaccine? Should we take a different vaccine that as compared to what we've taken in the past? Will that give a better immunity? I think this data is not clear, and we don't know what we call correlate of protection. What is the protection that a current level of antibodies or cell-mediated immunity can give to an individual? We do know that those individuals whose immunity is low because of underlying disease, post-transplant patient, those who are having chemotherapy, they are the ones whose immunity tends to wane faster, and therefore they may need to have a booster dose. But if you look at healthy people and you look at antibody levels, even after any vaccination, your antibody level will gradually taper off and come down to a low level. But
that's not all that represents immunity.
Yes, but then your bone marrow and cell-mediated immunity is still there, and the body recognizes the signal of the virus, and therefore whenever there is an infection, the marrow is stimulated to produce antibodies against the virus. So if your antibody level has gone down, that doesn't mean it cannot come up again once an exposure has occurred. So the fall in antibodies is natural after any vaccination. The booster just helps to bring it up again, so that whenever the infection happens, you are still primed against the infection. But it's not enough to say that if your antibody levels has come down, your immunity is no longer there and you will get severe COVID. We don't have enough data for that, and we need more data.
We definitely need more data. Though Israel's, they're giving their third dose of the vaccine, and according to reports, it's found to help in halting the spread of the Delta variant that is there in Israel currently. One more question, doctor. If we talk about, a lot of rumors or, what people believe in and online and WhatsApp, why do many people consider that Ivermectin is a COVID preventive, or even when they get COVID, at least in the US, you're seeing a lot of people popping Ivermectin? If you could tell us about this, because I do know that even in India initially there were thoughts about this. I know the Goa government was giving it to the public. So if you could tell us about what do we know about Ivermectin?
So Ivermectin is a drug which is an anti-parasitic drug. It is something that was used. There was initial studies which came from this part of the world, even from Bangladesh, which did show that taking Ivermectin early would decrease your viral load and may be beneficial. However, subsequently large studies which were done both from prophylactic point of view and even treatment for mild disease were not able to show its efficacy, and therefore it was not really put in any of the guidelines. There continues to be some data, but it's not strong enough. It does suggest it may be useful, but I don't think that currently we would say, based on whatever evidence there is, that Ivermectin has a role as far as prevention is concerned or as far as treatment is concerned.
All right, because in the US, you're seeing a lot of the anti-vaxxers are popping Ivermectin, and then they're having other problems. They're having to go to the doctor for all kinds of other problems that they're facing from, too much Ivermectin in this system. Well, that's all the time we have on the show today. Thank you so much, Dr. Guleria, for joining us and answering all our questions.
Thank you.
Thank you.